Today, Dr. Friedman will share his journey as a practice owner, how their thinking has evolved, and the lessons they learned in running and growing a medical practice in a more systematic way. Dr. Friedman is the owner of Friedman and Plastics and ENT in Scottsdale, Arizona. He is an ENT, facial plastics and cosmetic surgery specialist, and has been operating his own practice since 2014. Dr. Friedman is actually provided residency in 2008 to 2013 in New Jersey and did a fellowship in cosmetic surgery in Scottsdale, Arizona last 2013 to 2014. First question that I have for you, can you share your journey from being a clinician to owning a medical practice? What motivated you to start your own practice?
I think the driving force to open my own practice was to have autonomy and the ability to control every portion of my medical practice. Any successes or any failures that it may have incurred would be a result of my decisions and actions and no one else's.
Thank you so much for answering that. Now, being a practice owner means playing different roles. As you mentioned earlier, that you want to be in control of everything in your practice. So it means playing different roles, entrepreneur focused on vision and growth, a manager who does organization and planning, and a technician focused on clinical care. How do you balance these different roles?
I feel that the most efficient way to balance this is to find the staff and delegate the tasks outside of the patient care and their well-being to those that have been delegated to. Finding a staff and delegating the roles within that staff is one of the more challenging components of running a practice. But the staff clearly, first and foremost, is the backbone. Every and any successful practice. The success of the practice, albeit in my name, while it's my name on the doors, it's really the staff that works within the walls that's responsible for its success.
I agree, doctor. We really need to hire the correct people for the right roles, right? Now, doctor, which role have you found most challenging and why? Is it being the entrepreneur, the manager, or the technician or the doctor?
That's a good question. I think that any and every mistake you can make in entrepreneurship and business, I've made once. The most important thing is you don't make the same mistake twice. The tasks and roles in the practice, every time I step outside the realms or responsibility of patient care and their well-being, I create unnecessary traffic in my own practice, allowing the office manager to manage the employees, allowing the surgery scheduler to schedule the surgeries, and me just maintaining my role as the surgeon or doctor in the equation is the most effective and efficient way to run the practice. Every time I step out of the roles of the doctor and try to be the office manager or try to intervene with someone else's role that's been delegated, this is where the traffic and confusions arise.
We can agree that we really need to trust our people within our practice, right? So it's really important that they do their own job. We trust them on how to be responsible on their roles. Thank you, doctor. Now, how do you allocate time to work on the business aspects of your practice? Can you share some examples of how this has helped your practice?
I think the most simple way of answering that question is for every tax ID number or EIN number associated with each element of the practice, I like to spend maybe 30 to 60 minutes a day on each one of those tax ID numbers. For example, plastic surgery side, I will do an hour of charting and paperwork. On the ENT side, if I'm not seeing patients that day, I'll do an hour of patient care and follow up via telephone calls. As our surgery center is being built and going through the credentialing process, I'll do an hour on that role with respects to the organization or rounding up of documents that the Arizona Department of Health or Medicare requires. And that's really how I delegate the days that I'm working and try to allot 9 to 10 hours a day accordingly for each element of the business and practice as a whole. When you shortchange one of the elements of the business, believe it or not, all elements of the business can weaken. So you really want to delegate your time accordingly and address each element of the business, the property that owns the business that owns the property, the LLC that submits billing to the insurance companies, and so forth.
That's a very nice approach, Doctor. I hope it will also help other providers who will be able to hear this conversation as well. Thank you for sharing it, Doctor.
Sorry to interrupt. If I
Sure.
could just interject one thing, and I
Mhm.
noticed this is a trend in medicine, and I'm a bit of an outlier. But one thing is that doctor or the physician, they go to medical school.
Mhm.
After medical school, they do their residency.
Right.
After their residency, they may do a fellowship, they may not. After which point, they then usually work for a corporation, a hospital, or a large entity.
Mhm.
And the business component of the practice or running a practice or hanging your own shingle, as they used to say in the trade, has really fallen to the wayside. A lot of
Correct.
physicians out there couldn't really tell you how to run a business because their entire professional career has really been laid out in front of them and their roles defined by someone other than themselves.
Yes. Going on to the next question, Doctor, what processes have you put in place to ensure you are not stuck in technician or caring for patient role and can wear the other hats as well?
Field of ENT as it pertains to even plastic surgery or the cosmetic component of it, the way that I free up some time is this.
Mhm.
Clearly, you need enough revenue coming in the doors to pay your rent or your mortgage, pay your staff, as well as hopefully you at times will be able to pay yourself. Not always the case, though, when you're running the business. You may be the first in the door, last out, and for several months not receive a paychecks or such. This is one of the drawbacks or facts of life when running your own business. But in the ENT world, in the plastic surgery world, how I free myself up and allow myself to wear some of these other hats or take on some of these other responsibilities is this. It's ancillary revenue. And how define its ancillary revenue is CPTs, or common procedural terminologies, as we would call it in the insurance world. You try to find ancillary CPTs that benefit patient care that don't necessarily need to be administered directly by your hand. For
Mhm.
example, in the ear, nose, and throat world, you may have a hearing health department to the practice in which you contract or employ an audiologist or hearing health specialist. With reviewing of their audiograms and tympanometries and the
Mhm.
distribution of hearing aids, you're able to generate ancillary revenue that doesn't entail you being in a patient exam room for
Mhm.
45 minutes with your patient.
Mhm.
Mind you, you're still overseeing the work and making sure it's being done competently and diligently, but
Mhm.
that 45 minutes not in that room with the patient, which avails you, say,
Right.
45 minutes to go through emails or make sure your bills or your sales rep and balances are all squared away. And it helps you free up some additional time. And as you build these ancillary CPTs, you're able to offer your patient a full spectrum of care in your field while you yourself are not in the room with that patient. So the
Mhm.
patient is maximizing their overall experience at your practice, maximizing the field of health in which you specialize, and you are not in that room
Correct.
one on one with that patient and avails you the time to then wear other hats in your practice and run it.
Very nice, Doctor. I love the idea that you got into all the CPT codes, all the CPTs that can be delegated or administered by other employees or medical assistants. That's a good approach, Doctor. Again, it will boil down to delegation approach, but it's good to know that you get that information or get the basis from the CPDs that can be delegated to other staff. Thank you, doctor. That's a good one. What steps or systems have you put in place to ensure your practice is being run efficiently? Can you provide any examples or processes that have been effective?
Think that you don't want to be in the weeds of it, but you want to have at least a overall view of every element of it. For
Mhm.
example, for the monthly grossing from the plastic side of the practice or the ENT or some of the independent contractors that the practice has now acquired, I'm provided a spreadsheet monthly of the breakdowns of their surgeries, the patient evaluations, their highest yielding CPTs via pie graph. This is one of the things that WRS and the billing team provides me, and I
Mhm.
can follow the trends now over the years.
Mhm.
There's seasonal variations, there's annual variations. However, when you're looking at these things over the course of now a 10-year practice, you're able to see from a 10-foot viewpoint, okay, this drop or this grossing part of the practice is down $20,000 this month. Why is that? This part of the practice is up 30,000. Why is that? And then you can delegate the fine tuning of these areas where you see fit. Now, clearly, money is not the driving or the almighty ruler of a practice, but the revenue generated from it is a reflection of the services rendered. So if one element of the practice is deficient in monthly revenue, you look at that area and say, okay, let me dive further into it. You
Mhm.
start from an overall view of each area of your practice or revenue streams. And when
Mhm.
you see something is off in that area, that's when you take a deeper dive. But if you're so thick in the weeds of every element of the practice, you're going to get lost in the minutia and the details. And now you're kind of intervening in the tasks that have been delegated to other employees or staff members. And you're coming outside of the role that you're supposed to be providing, which is
Mhm.
the medical practitioner or a medical health provider.
Yes, doctor. I'm glad or I'm happy, doctor, that you are actually one of the providers or practice owners who are or who believe in data, because not all providers, not all people is data driven. It's really important that when you decide on your practice, you really have to have a basis, and that's your data. So it's good that you're checking your data, doctor.
The
Mhm.
data checking and all of these elements was not something that was learned in medical school. It was
Correct.
learned on the fly. And, one of the elements of the medical education that I think we fall short on, while the doctors are well trained in diagnosis and management of medical issues, there's very little time allocated in medical school to the business component of it. So when
Mhm.
these young physicians are coming out of medical school or residency up to their ears in debt with no formal training on how to run a business, this
Mhm.
is how they fall into a system of always being employee and never
Mhm.
being an employer because
Mhm.
they have no training or experience in it.
Yes, with regards to that data, doctor, and also being an employer, what key performance indicators do you track to manage and measure your practice's performance? And how has having these KPIs help you drive improvements?
This is a good question. Essentially, what I do is this: I stay up to date with the current and most effective means of medical management and procedures offered. While procedures are always evolving, you never really lose sight of the basics or the rationale for doing them. But with
Mhm.
the evolution of procedures comes the evolution of the CPT coding and the billing paradigms. And these paradigms, if you stay up to date with them, it's based on the medical research and the medical years of study before they become approved from, say, a Medicare entity. And when you stay in the interests of the patient while maximizing care, while minimizing the invasivity or the aggressiveness of the approach, you're going to get good results and you're going to get happy patients and you're going to do it with the least invasive means possible. And when you, at least from the ENT field, when you utilize some of the lesser invasive means that they offer before all out surgery and anesthesia, while these CPTs can offer larger reimbursement units. And when you stay up to date with their care and you offer full comprehensive spectrum of it, you're able to maximize insurance revenue while
Mhm.
maximizing patient care and minimizing surgical exposure. And when
Mhm.
you stay up to date with the newest innovative trends in medicine, these yield the higher reimbursements. Now, I'm not suggesting that you go ahead and offer higher yielding procedures in terms of what they gross or reimburse.
Mhm.
You offer the most effective, efficient means of treating a patient while minimizing their risk and downtime. And it just so happens that these less invasive approaches offer more favorable reimbursements from insurance companies. And when you're maximizing the insurance reimbursement, you're able to deliver maximum care
Mhm.
while maximizing your time and its efficiency. A physician could be only in one place at a time. And when you're in that place, you need to be dedicating 100+% of your attention and focus to the
Mhm.
task or patient in front of you. So
Mhm.
when you're able to do that at a most cost-effective means, you're maximizing your earning potential while delivering exceptional above and beyond care to the patient. So it's a win-win for everyone involved.
Thank you so much, doctor. I really love that idea, getting up to date in the medical practice to make sure that you're providing the most efficient care for your patients, doctor. Do you have KPIs for those staff who is not involved really or heavily involved in clinical side of the practice?
As it pertains to the staff and their role, as the practice or as anyone's practice grows, you're going to have more employees involved.
Mhm.
What I do with respect to employees is this, very simply. I encourage three things of them:
Mhm.
punctuality, attitude, and effort. I
Mhm.
encourage a team-like approach, meaning that nobody on this team we are going to let sink. Because if one team member is sinking, the practice is sinking. I say
Mhm.
hello and goodbye. I'm cordial, and I ask them daily of their life
Mhm.
and things that happen in it. There are
Mhm.
individual roles and the elements or the KPIs that you suggest. This is a task that I delegate to my office manager. And essentially, if there's problems in the practice or with staff members having any issues amongst staff,
Mhm.
vacation requests, problems with this healthcare provider, all
Mhm.
those matters, I tell everyone when they start this practice, and it's reinforced monthly at our meetings, they need to bring that to the office manager's attention. The office manager's role is the management of the staff. And if you're trying to manage every employee on your own, you are just not going to succeed in that task because it's an impossible one. Clearly, I care about all of my staff members. I view them all as family, but I just don't have the time to address each one individually. And you can't really spend more time with one staff member than another because then you're playing favoritism and that wouldn't work in the practice either. So KPIs and day-to-day performances, that's a role of the office manager to handle. And because that office manager has been with me probably almost as long as I've had this practice,
Mhm.
I trust she's doing a phenomenal job at it.
Thank you so much for sharing that. I love that you just want to spread punctuality, attitude, and effort throughout your staff. And then you delegate the task to the practice manager to handle the KPIs or to handle.
100%. 100% punctuality, attitude, and effort. These are things that transcend any education level, any role in practice. If you bring those three things to the table, you are a productive, beneficial employee, and those are the ones that I like to see on the team.
I really agree on that. Now, let's move forward to the next question. How do you ensure your staff is aligned with this vision?
Where my practice is now, I have a practice, an ENT in Scottsdale that I have an independent contractor.
Mhm.
I have a ear, nose, and throat practice in Payson, Arizona that I am an active healthcare provider. We have a cosmetic surgery practice that I'm a fellowship director. We have a cosmetic fellow. That cosmetic fellow is also now doing gynecology up in Payson to supplement his income and offer more comprehensive care to our patients. We have a Medicare facility that we're trying to get through the last leg. So now we have an accredited surgery center. I'm saying this not to boast, but to describe this practice as it continues to grow.
Mhm.
As a practice grows, you got to look at this thing as a monster, if you will. And as this monster grows and grows and grows, you need to continually feed it. And its appetite will always grow. And in the
Mhm.
growth of its appetite, costs money to run it. And where you get to a point is you can't gross enough to feed the monster. So you always want to be cognizant that you, while always expansion and growth, you don't want to outgrow what you can feed it, because then you're going to get burnt out mentally, burnt out physically, and burnt out financially. And I brush up on this thing all the time, because if it were up to me, I would want my practice and the members in it to just take over the world, not because of an ego driven, just because I'm just so fond of my staff and the care we provide. But in doing such, you always got to be cognizant. You got to crawl before you walk, and you got to walk before you run. And when you're going in the wrong direction and you try to run too fast, you get yourself into a bit of a problem.
Now, doctor, how do you go about thinking about possibilities and opportunities for your practice, how it can grow, how it can be run more efficiently, etc.?
It's a trial and error. Like I said, every mistake in business I've made once, I just try not to repeat it. And through trial and error, you find what works and what doesn't work. The independent contractor for healthcare providers, I like that because those that are incentivized to work and deliver excellent care, they'll benefit financially from this independent contractor relationship. The more work they do, the more they can gross for themselves and their family in support of it. So that's a good way for growth. It's a means that it doesn't take away from me taking care of my patients. And it certainly avails the opportunity for the entity or the practice to take care of more patients with more healthcare providers. And the independent contractor relationship is a great way to do it, because they bring to the table a means to support themselves and not have the practice support them.
Now, can you share an example of a change you put in place that required getting your team on board?
We do is monthly meetings. I have so many balls in the court, so many ideas and things going through my head. And what I always want to let the team know is that while I'm the captain of the ship and I have the course of the ship allotted and where I'm heading, my goal destination, it's important that the ship's crew members kind of have a general sense of where you're going to, so they know that the captain of the ship has a course allotted and they're not just circling in chaos. Keeping the staff in the loop of where I'm going and what it is and the goals and objectives of the month, of the 6 month, of the year, of the 2 year, while not giving them too much detail, since it's not necessarily their role or responsibility. Keeping everyone in line or having their eye on the prize or the end result or goal is a way that I keep the practice and everyone in it kind of moving in the same direction. I think that if staff members don't know the method behind your madness, as I guess you can say, they really have a hard time staying on board, embarking on the journey with you. But as long as you keep them in the loop of the end game and where you're heading and your goal, you'll find that most of the staff is very supportive of it when they believe in the mission. Essentially, we have daily goals, weekly goals, monthly goals, and long-term goals. The end result is essentially to have a fully accredited licensed surgery center attached to the clinic in which we practice. This has been a long-term goal of the practice for 6 years, and everyone being on board for that is really our end destination. And everything we're doing day to day, in addition to delivering excellent care, really is that end goal, because I think when you keep the staff in the loop and you keep everything internal amongst your family, meaning while surgery centers are great, hospitals are great, you're now relying on outside entities for the management of your patients. And when you can keep everything in-house, meaning amongst the family and not having to utilize outside resources, it really helps in your overall mission.
Thank you, doctor, for providing that. Now, I know earlier we already talked about the data. I want to go back to that conversation. How do you use
Okay.
data Mhm. To identify areas for improvement in your practice. And can you share an example where metrics led to significant changes?
Yeah, I think one of the things where we use data from the sheets that are provided from my WRS billing team, I look at the rejection rate of claims. Now, albeit it's very, very minute, and I think it's because we've really used the data to hammer it out. But rejected claims really are an area of continual frustration for me because one thing for certain is if they were seen by me or my team, they got exceptional care. To not get paid for it while it's frustrating because that time was still spent, not wasted, but spent. And the staff needs to get paid, the rent needs to get paid, the lights, the billing, and all these things, everything has cost. So when you have a rejection in claim, it's a lost revenue. So what we did was when we were getting claims rejected with like the 5 or 6 or 7% realms, now it's 1 or 2% at highest. But utilizing that data and the sheet that the WRS team would provide for me is this. Okay, what's the two top reasons? What's the three top reasons why we're getting claims rejected? One of which is with the evolution of Medicare replacement plans. These Medicare replacement plans are very frustrating because the patients will come in and say, we have Medicare. Because the way that these plans are proposed or offered or sold to them is just with that explanation. So they're not really informed with what it is that their Medicare replacement plan and all it entails. Some of these require pre-authorizations, et cetera. And my staff that originally, because they still need to be educated, the medical insurance world is ever evolving and changing. It's hard to stay with it. But with the utilization of data and finding out why these claims were getting rejected, we implemented a new strategy of intake when it comes to the patient demographic sheet, such as, okay, do you have Medicare? Wonderful. Hey, do you mind if we just see a copy of it since the last time you were here was, say, 18 months ago? And wouldn't you know when we're collecting with the patient says, oh, I have Medicare, it's now morphed from the 18 months to a Medicare replacement plan. Then we note that this is a Medicare replacement plan that we may or may not accept, or may not need pre-authorization before we do, say, an allergy test. And with the extrapolation of the data from the rejection rate, these are ways that we were able to home in and improve or minimize the percent of rejected claims. So there's a wonderful example of how my staff is educated with the extrapolation of data, its utilization, and means of improving on the revenue generated for the services rendered.
Thank you so much, Doctor. We really can improve something, or we can really solve something if we really dig deeper into the root cause of the problem. And we can dig deeper into the root cause of the problem if we use data. Thank you so much for that wonderful example, Doctor. And I really appreciate that. That's a really a good example. Now, how do you ensure continuous improvement based on the insights gained from the data analysis?
Continuous improvement, I say you can never get complacent. Complacency is a way that things will start drifting in the wrong direction. One of the areas that I'm always stressing to the billing team, and they do an excellent job these days of it, is with aged claims. These insurance companies sometimes are very slow to pay for whatever reason it is, whether they're overworked or they really want you to chase them down. I don't know why it is, but you must stay diligent with aged claims and really what I always say is shaking the tree. You really want to shake the trees of these insurance companies that are dragging their feet on aged claims. Maybe they get lost in the shuffle or the files on the insurance company's side. But staying on top of aged claims over 90 days is very important. And sometimes when you extrapolate from the data of the aged claims, it's certain insurance companies. My practice in Payson is near and dear to me. So I would very, 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 very reluctantly ever not want to take any and all insurances of the people up in Payson because it's really much like my family. I view my patients up in Payson with the ENT component of my practice, as well as the Scottsdale plastic patients. But Those people up there are like family, and you never want to tell a family member no. But sometimes when you have only so many hours in the day, or your staff only has so many hours in the day to delegate to their care and the collection of for services rendered, some of these insurance companies are becoming so difficult to work with that oftentimes, while it's hard to do, sometimes as the owner of the practice, you have to make a tough decision and just tell patients, we no longer accept that insurance. It's a very difficult conversation to have, or a decision to be made, but unfortunately, sometimes it must be done.
Also, we have to choose our patients as well, because you are a practice owner. You're not just a doctor. You are also, you know, managing the whole practice. You have staff, they have salary. So you really have to get those decisions done. Thank you for sharing that, doctor. This is the last questions that I have for you. Can you talk a bit about WRS Health as a partner? How has WRS helped your practice, and what were the outcomes or results of that?
Yeah, WRS, I've been with them for some time. I started with WRS in 2015. How I came across them was very early on in my practice. I was using another EMR system, and this was just a nightmare from the jump. So when I went online, believe it or not, from my residency all the way back in New Jersey, one of my previous attendings, or even an attending of my attendings, Dr. Jerry West, was on your website. And knowing of him and his reputation and his vouching for WRF is what got me to jump on board. And I remember three people back then was Patty, I believe a gentleman who's no longer with the practice. I believe his name was Jeff Hirsch, and an OBGYN PA who took me through step by step the system and how it worked. And ever since then, I've been allegiant to WRS, as they've always been very helpful. And as the practice grows and WRS grows, a lot of the services that I offer, a lot of the services that WRS now offers, have grown together synergistically, and it's been really a long, wonderful relationship. Without the WRS team, it would be very difficult for me to predict I'd be where I am now. They handle the billing, the EMR notes, the credentialing, as sometimes these insurance companies can be very frustrating to deal with. I will voice my frustration to the WRS team. They get back on the horn and they make sure to get the job done. When you're dealing with beasts like state insurance or Medicaid, or some of these private insurance companies that are real tough to deal with, and them dealing with those headaches or stresses have alleviated a tremendous amount of stress from my day-to-day routine. And without the relationship I have with WRS, it would be very difficult for me to determine where I would be these days, because they're instrumental and pivotal in the practice of success.
Thank you so much, doctor, for that wonderful feedback. I am glad to hear that you value our partnership and that you appreciate the support you're receiving from us. Thank you so much, doctor. We value, doctor, your practice as well, you as well, doctor. Thank you so much once again, and for your time today. We will be saving this for future purposes or for future reference. Thank you so much for sharing your insights, doctor, and for your time today. And of course, if you have any questions moving forward, or if you need any help, you know who to reach out to, doctor.
You got it. Thanks for your time. A pleasure talking to you. Have a great day.
Have a great day. Bye-bye, doctor.
Bye now.